when it comes to older adults who are having cognitive change, I feel really strongly that we must look at the brain because diseases like Alzheimer's disease are brain diseases. And so we need to look at the brain. Still, people ask, including healthcare professionals, like, why do we need to get brain imaging? Well, there's important things we're looking for on the brain scan. And an MRI brain, typically we don't need to use contrast unless there's concern for potentially tumor, cancer, infection. Usually, if you're looking for those, it should add contrast. So with and without, it's called gadolinium when it comes to an MRI. But an MRI is going to give us a much clearer picture, especially if we're wanting to look for any changes due to things like Alzheimer's disease. So what are we looking for with the imaging? We want to look for any surprise findings, such as a tumor, strokes, or brain bleeds. Now, I'm saying surprise findings because the person, I've examined them and they don't have any what we'd call focal neurologic findings to indicate that maybe they had a small stroke, and say they have, weakness on one side of their face and then their arm on that side. And sometimes that can happen and it's pretty subtle and it doesn't lead to the person going to the emergency department at the time of, but we pick up on it after. And then we're looking for atrophy or shrinkage in the brain. And in Alzheimer's disease, and in some other causes of cognitive impairment, we see shrinkage in the hippocampus, which if we look in that picture on the bottom on the right side, those little areas toward the bottom and on the inside, that's in the medial temporal lobes. The hippocampus is the short-term memory center of the brain. That's where you're storing new information that was just provided to you or was just learned. And so that area is often the first to start atrophying or shrink in Alzheimer's disease. And so you can see here that brain tissue compared to the left side, which is the normal healthy brain, which is much plumper. The one on the right, the Alzheimer's brain, is not. It's a little more shriveled up. And then we have atrophy of the cortex in Alzheimer's disease, which you're going to see as the disease is progressing. The cortex is the outer part of the brain, which controls all the higher thinking functions like language, visual spatial skills, executive function, which is like planning, multitasking, organizing. And so those are represented in different parts of the brain. And so those are the things we're looking for. And also cerebrovascular disease burden. That's deeper in the brain. And if a person has a lot of that, we call that white matter disease or white matter changes. And I'm telling you this because you may see this on you or your family members' brain MRI report, that maybe there's a mild or moderate amount of white matter changes. And when there gets to be a moderate degree or more, that could be a primary cause of cognitive impairment.